Okay, welcome back. So now we've done the entire airflow pathway, and then we looked in great detail about the uvula. So let's back up at this point and look at the lungs and the thoracic cavity as a whole. So on the right lung, we have three lobes. They're called the right upper, middle, and lower lobe, or you can call them the right superior, middle, and inferior lobe. It doesn't matter. And on the left, you only have two because part of the space is taken by the heart over there. And so you actually have this big curve where you can see where the heart fits nicely. Now, all structures have to enter the lungs through one area. So that includes the airways and the blood vessels and the lymphatics. And that area where everything goes in and out is known as the hilum of the lung. This is not the first, nor will it be the last structure that has a hilum. We saw them in lymph nodes. We had it in the spleen. We're going to have it in the kidneys. We just have it. It's a great organizational way where you only have one entrance and exit for everything. Looking at the lungs, they're surrounded by that serous membrane known as the pleura. And of course, this has the two layers like all the serous membranes have. So we have a visceral and parietal pleura. And this is super thin, basically. It's a simple squamous epithelium. And the pleural cavity is the space between the two layers. So I don't know why, but students often get confused about this, and they think that the lung is sitting in the pleural cavity. It's like they think the heart's sitting in the pleural cavity when it's not. So if we have a rib, so we've got ribs, then if we look, there's a little bit of muscle on the inside of the rib, whose muscles then we didn't bother learning. Then we would have the parietal pleura, followed by the pleural cavity, then the visceral pleura, and then you would be seeing all the alveoli in the lungs. So, pleural cavity does not contain the lungs. It's essentially a potential space, although it does contain a small amount of fluid, which should not be mocked because that fluid is super important. It reduces friction every time you breathe. Then your lungs are rubbing one pleura against the other. That fluid means that they're not rubbing cells against cells, so it's not generating the heat and impeding movement. It also is important for creating a pressure gradient, which decreases the resistance during lung expansion, but that's beyond the scope of an introductory anatomy and physiology class. And lastly, in our lungs, we have a blood supply and we have a lymphatic drainage. And you go, oh, I know this blood supply, I know that pulmonary circulation, pulmonary trunk, the pulmonary arteries, the lung capillaries for gas exchange, pulmonary veins back to the left side of the heart. And I go, great. That's to bring blood back into the heart for gas, after gas exchange had happened. That's not to bring gas to the tissues of the lung, because like, duh, we're bringing deoxygenated blood. Do you really think that's what those bronchi want, deoxygenated blood? So yeah, when in the alveoli itself, because the walls are millimeter, it's one cell thin, they can get gas exchange, but that doesn't happen in those bronchi and bronchioles. We have to have a circulation for those. And that circulation is not going to be the pulmonary circulation bringing its sad deoxygenated blood to the lungs. So we have to have systemic circulation that goes to the lungs. So we have blood vessels that are actually coming off of the aorta. And these are our bronchial vessels supplying oxygenated blood from the bronchi and the bronchioles. Yeah, so we got red blood going in and blue blood exiting, which will eventually drain to a vein known as the azygous vein, which jumps into the superior vena cava. It's the last blood vessel that jumps into the superior vena cava before the superior vena cava drops its blood into the right atrium. And with that, we are almost done. We have to look at lymph nodes. So all along your airways, you are going to have lymph nodes. So, and you're going to have the lymphatic capillaries, you're going to have the lymphatic vessels going to lymphatic trunks. And so we are going to have amazing lymph drainage of stuff, including all the black soot stuff you inhale living in a city. And so These lymph nodes can get enlarged significantly if you have lung infections or if you have lung tumors. And in that case, the lymph node actually can cause partial obstruction of an airway, which is not a good thing because it can cause a recurrent pneumonia if it wasn't a pneumonia that caused it to be enlarged. But that could get you into your primary care physician, so could you give you an earlier diagnosis. So it can kind of be a good thing, even though it's a bad thing. Anyway, with that, I am done with the lung, and we are going to come back and learn what happens with breathing. Thank you, and I'll see you shortly.